and good afternoon. It is Friday and it is time for our regular Lunch and Learn. And I'm so glad you joined me. Thank you so much. Yes, I'm broadcasting on my personal page because we're just going to see how this works. But you can also catch us on our YouTube channel and also on our group, Hope for Chronic Disease, right here on Facebook. So today we're going to start with part one. It's going to be a 2 or maybe 3-part series about Lyme disease. Now, what is Lyme disease? Lyme disease is, some people say that it is just a catch-all name for baffling disorders that the doctor doesn't know what to do with. A lot of times the treatment will be a chemotherapy, and people are a little bit hesitant to try that. But I want to start at the very, very basics and talk about Lyme disease. It is very difficult to treat. We have had people that have come in with Lyme disease. They have become so much better. So there are some holistic remedies that we're going to be talking about, probably not today, but today we just want to lay out what is a Lyme disease, how can you test for it, and how can you treat it? How can you prevent it? So in a nutshell, Lyme disease is a crippling condition for many individuals. Functional medicine, wellness centers can help people with Lyme disease for sure. Why is that? Because we know that every sickness, every disease is an aberrant vibration. So if you nullify that vibration, if you cancel that vibration, then the body is not going to have to put up with that irritation. So what is Lyme disease? The origin of Lyme disease, also you might know it as borreliosis, is disputed. From what we understand, it was first recorded in 1982 in Lyme, Connecticut. It is a spirochete bacteria, and it was discovered by a man named Willy Bergdorfer. And so the name of the bacteria, they named it Borrelia burgdorferi. All right. Since then, the rate of Lyme disease, has grown. Excuse me. And now Lyme disease is the most prevalent tick-borne illness here in the United States. Now, what is a spirochete bacteria? Spirochete bacteria is a corkscrew bacteria that burrows its way into the mucosa of your skin. It burrows its way down into the tissues, so you're not really able to get rid of it very easily. And so it's something that's, we're going to talk a little bit about how it changes shapes. It's a shape shifter. And so when that happens, when you're dealing with your medical professionals, they're going to be looking for X, and it's going to be presenting as Z. And so the medications that they're giving you may not be the ones that are most appropriate for that. So according to the Centers for Disease Control and Prevention, there are nearly 500,000 people diagnosed with Lyme disease every year. Many natural health practitioners believe that Lyme disease and other tick-borne pathogens are grossly underdiagnosed and frequently missed. One 2018 study published in Healthcare, this is a Swiss magazine, suggests that 12% of Americans could have been infected with Lyme by 2015, and some 56 million people are currently infected. So this really is a chronic situation. It's a chronic disease, and it affects, as I said, 55 million people. So that's a lot. That's a lot of people. The tick bite usually comes from the eastern black-legged tick or the western black-legged tick, and it is the most common vector for the Borrelia burgdorferi, the bacteria that causes Lyme. Many speculate that this bacteria is not just transmitted via ticks, but also carried by fleas, mites, and mosquitoes, as well as being sexually transmitted. Now, I've never heard that Lyme disease can be sexually transmitted. And the article goes on to say that this is hotly disputed, that it can be sexually transmitted. But obviously there is a sector of the holistic health people that think that this is possible. So you want to be really, really careful. Now, I don't know about you, but down here in South Texas, we do a lot of hunting, and we've got property in Buffalo, Texas. I don't know if you know where that is, but it's halfway between Houston and Dallas on I-45. And we've got some family property there, and we go out on the property from time to time. Whenever we come back in from the property, we do a tick check. My husband will check me, underarms, back, all that kind of stuff, to make sure that I did not come home with a critter. And I do the same for him. So if you go out into the woods where there are ticks, then you need to do a tick check to see if perhaps you've been bitten by a tick. Nobody wants to think about that. Nobody wants to get a tick bite. But if you're out in the woods, there's a possibility that that is going to happen. Now, most people understand that the Lyme disease is in the upper East Coast of the United States of America, but we do have people here in our clinic that have been diagnosed with Lyme disease who have never been out of the state of Texas. So just take that for what it's worth. You don't want to be infected with ticks or fleas or mice or any of those kind of things. Lyme disease can have a devastating consequence on the body because of the propensity to create systemic inflammation that hinders the immune function and can potentially trigger autoimmune disease. So this is why some practitioners say that Lyme disease is a catch-all label for other autoimmune diseases. And when you get one on top of another, then they group it into a cluster and they say that you have Lyme disease. I'm not here to dispute that. I'm not here to argue that point. I'm just saying what people out there are saying. So there are a wide range of symptoms for Lyme disease, and it can be those particular ticks or it can be other ticks. If caught early, Lyme disease and other tick-borne pathogens can be treated rather quickly. If left undetected, various health concerns can arise, potentially contributing to a systemic inflammatory response, autoimmune disease, and chronic illness. And that's usually what we see. We see people come in with fibromyalgia. We have people come in that have chronic fatigue syndrome. They just have no energy. They can't do anything. They're in a lot of pain, and it's just chronic, one thing on top of another, on top of another. Many people who contract Lyme disease don't ever recall having a tick bite. They've done the tick check, no tick. Excuse me, there's something in the air and I apologize. Most of the time, people think that if you have Lyme disease, you're going to have the classic bullseye rash. And what that is a rash where it's a bullseye maybe white head on it, and then a red circle around it. And it is called the bullseye rash. It's very definitive. If you see it, it is an indication that you have been infected with that bacteria. But only 70% of people who have contracted Lyme disease will have that bullseye rash. So if you have some of these symptoms and you've never had the rash, you're not alone. About 30% of the population have not had that rash. We hope that doesn't happen. So when this rash develops, it's usually within 3 to 30 days after having been bitten by a tick. It starts relatively small. It gradually expands over the course of many days. It can reach a diameter of up to 12 inches or more, and it can appear on any area of the body. Sometimes the skin clears up as the rash enlarges, becoming a bullseye shape. While there are many classic attributes of this bullseye rash, there are many variations, and other rashes also can arise from a tick bite. So if you have acute Lyme disease, that would be within 3 to 32 days after the tick bite. These could be your symptoms. You could have a headache, malaise. Malaise is, I don't feel good. I don't want to do anything. I don't want to move. It's extreme fatigue and just a real bad attitude. Weakness, fever, muscle soreness, joint pain, neck pain, flu-like symptoms, swollen lymph nodes, and of course the rash. Now, You've got your lymph nodes in your neck, in your armpits, down your spine, in your groin, and behind your knees. So are you going to feel swollen lymph nodes in your spine? No, you're not going to. Are you going to feel swollen lymph nodes here in your neck? Yes, you will. I always, every night when I'm brushing my teeth and cleaning my face, I'm pushing on this part of my neck right here. And the reason I'm doing that is because I'm feeling for my lymph nodes. Now, that is the first indication that you have come in contact with a bug, a bacteria, a pathogen, because your lymph nodes are designed to catch that bacteria, pathogen, whatever it is, hold it there, let the macrophages and the phagocytes eat it up. And if that is happening, your nodes are going to be swollen and they're going to be tender. All right. In your armpit, when you're feeling around in your armpit, hopefully you do. If you have a massage therapist, your massage therapist is going to raise your arm and going to poke around in your pit. Why are they doing that? Because they're checking your lymph nodes to see if your lymph nodes are enlarged. You can feel along the crease, the inner crease of your leg in the groin area. And if you have enlarged lymph nodes, it's going to be really sore there. And you can also feel behind your knees. If you feel any pea-like structures, that's your lymph nodes. You're not supposed to feel them. So if you're feeling them behind your knees, they may not be sore, but if they're hard little peas, then they've got something going on, and you need to make sure that you get your lymph flowing like it needs to. Remember, the lymph is the vacuum cleaner of the body. It takes care of all the pathogens, the germs, the debris, the cellular, whatever the cells are trying to get rid of. It's going to go through the lymph nodes. That's what it's supposed to do. The lymph travels through your body, dumps into the liver. The liver dumps into the large intestine. And of course, then you go to the bathroom and you get rid of all the trash. So if your lymph nodes are enlarged, that means they are doing their job. It's nothing to complain about. It's nothing to worry about, but we want to facilitate that. So how do we do that? How do we move our lymph? You move your lymph by moving the long bones in your body, your arms. So you want to be pumping your arms up and down, and you want to be doing high stepping, right? When you do that, you are moving the lymph in your body, and it's going through those channels, through those nodes, so that the phagocytes and the macrophages are able to do what they need to do. So if you have swollen lymph nodes, there are some herbal formulas that you can take. My favorite one is called LCW, and that stands for Lymphatic Cleanser. And it is absolutely amazing for getting your lymph moving. You don't want to take an herbal formula. You can do an infrared sauna, because that's going to get your lymph moving, and it's going to help with inflammation. So there's a lot of things that you can do and you want to do. You want to be aware of what your body's doing. And at the very first instance that I have of my lymph nodes being a little bit swollen, and they do get swollen from time to time, I immediately get on my antibacterial herbs, my antiviral herbs, and so far so good. It works out for me, and I have not been sick in multiple years. Okay, so thank God for that. If you have untreated Lyme disease after several weeks, then this is what you can expect to have. You can have facial palsy. That is a loss of muscle. You can't smile. You can't crinkle up your eyes on one side of your face or the other. It can be on both. You can have ringing in the ears. You can be dizzy. You can have vision changes. You can have shortness of breath. You can have a sore throat. You can have abnormal heart rhythms, nerve pain. You can have a new rash that comes up, stiff, achy neck. You can get meningitis, and you can get mild encephalitis, which causes memory loss, sleep disturbance, or mood changes. Now, this is just a big catch-all list, because I'm looking at this list. I've had every one of these things, and to the best of my knowledge, I've not been bitten by a tick. I've never had the bullseye rash. I don't have these symptoms all the time, and I don't have them in a cluster, but from time to time, I've had, except facial paralysis. I don't think I've ever had that, but never had the bullseye rash either. But I've had these other things from time to time. So don't kind of get all twisted up about it if you have some of these symptoms. Now, if you have some of these symptoms and you have them often and you have the clusters often, it's a chronic thing with you, then you definitely want to look and see if Lyme disease might be your, that might be what belongs to you at this time. If you have chronic Lyme, these are the symptoms: chronic fatigue, chronic inflammation, migratory joint pain. That means it hurts on this hip today, it hurts on the other hip tomorrow, it hurts on my knee, then it hurts on my shoulder, then it hurts on my fingers. So it migrates all over the body, it moves. You will have severe headaches, chronic encephalomyelitis causing brain fog, cognitive dysfunction, insomnia, migraines, and vertigo. That's a lot of symptoms right there. Dizziness, shortness of breath, sore throat, tremors. All right. We have people that'll come in and their doctor will say they have idiopathic tremors. Idiopathic means they don't know what caused it. Not ruling out Lyme, not saying it is Lyme, but they're just trembling, just like that. We try and rule out Parkinson's disease. If there's Parkinson's disease in the family, then we can give a supplement that will produce dopamine in the brain that will stop with that. But we've also seen with idiopathic tremors that CBD oil really helps with that. And we've got really good CBD here at the clinic. And I think we've got a special going on for the month of December. So check into that if that's something that you're looking into. We've got that here for you. Other infections are respiratory infections, elevated liver enzymes. Now we see that a lot on blood work. We see elevated liver enzymes, anxiety, panic attacks, rage, paranoia, depersonalization, gastrointestinal symptoms, neurodegenerative diseases, new food allergies, multiple chemical sensitivities, and menstrual irregularity and infertility, and also seizures. Now, I've never had any of these symptoms. I have had the occasional respiratory illness, but it's been years and years and years. I've had the occasional sore throat, but I haven't had all of these clusters together. I'm not saying you're going to have every one of these symptoms, but if you have 3 or 4 of these symptoms, then you might want to get checked out and see if maybe you might have Lyme disease. So why is Lyme disease difficult to treat? It is a dreaded condition because the solutions are not easy. And this is because the spirochetes can change their form. And this is what I was talking about earlier. They change their form so that they can attempt to escape or evade the antibiotic treatment. So if you get diagnosed with Lyme disease, they usually, certainly in this part of the world, I don't know where you are, but in South Texas, they normally refer you to a clinic in Colorado where they do this chemotherapy type protocol on you. It's been successful to a greater or lesser degree. I don't think it is a cure. I've not heard that it is a cure. I know people that have gone and done it and they have become better and then they have relapsed. So I don't know that it is a treatment that has long-term effects, but that might be something that you want to do. These forms, the changing of the spirochete, all right, they're called, it makes this pathogen called a persister, all right? Why is that? Because it persists. Normally, if we get a bacteria, we take antibiotics or we do antiviral antibiotic herbs, right? That's what we do, and we get rid of it. But the persisters, they do their shape shifting, okay? And it evades the antibiotic. They turn into a different component. They need a different antibiotic, okay? They take on various shapes and sizes, changing from the well-known forms into altered morphologies. They're able to form round bodies, L-form bacteria, microcolonies, or biofilms. Now, what is a biofilm? We see this often in older people, okay? So in your body, from your mouth all the way through to your bottom, you've got a mucous membrane that goes all the way, both ends, right? That is the very first thing. That's the very first structure when you're being formed in your mother's womb. And that mucosa is supposed to block pathogens from getting into your internal organs. It's supposed to grab them if you ingest them, which is how normally you get them. You ingest them, they are in that mucosa tract. The mucosa tract keeps them segregated from the rest of your body, and they just pass on through when you move your bowels like you're supposed to. Obviously, some don't get passed through. They set up housekeeping in the mucosa. The mucosa gets really thick, it quits doing its job, and it becomes a holding tank for pathogens, bacteria, viruses, critters, parasites, amoebas, that kind of thing. The body is full of biofilms always. So what we need to do is we need to constantly be turning over that tissue, casting off the dead tissue, rebuilding the new clean tissue so we don't have biofilms. When you have a chronic disease, it could be because you're not moving your bowels like you should, 2 to 3 times a day, every day. So if that's not you, then you probably have a biofilm. We need to take care of that because it hosts critters. We don't want to do that. Biofilms are remarkably resistant, right, to the antibiotics and the treatment, and the bacteria protect themselves from treatment and infect the immune system through the biofilm. Many believe that Lyme disease becomes chronic because the round of antibiotics is often insufficient treatment, and the Borrelia is able to adapt in the face of the antibiotics. And this is why a functional, holistic approach can be valuable. Yes, we agree with that, right? So in addition to the Borrelia burgdorferi, the ticks contain many other pathogens, including bacteria, parasites, and viruses that can contribute to acute and chronic illness. And some of these include, and I'm going to get all these big names mixed up, so I'm not even going to try, but this is an infection that starts off as a flu-like illness, and it can be fatal if left untreated. I think you would say it anaplasmosis. Okay. So you want to look at that anaplasmosis. You can Google it and you can see what it is. You feel like you have the flu, but it can actually be fatal. Babesiosis. How you like that name? This is a result of microscopic parasites transmitted through the various tick species. Symptoms include chills, fever, drenching sweats, anxiety, shortness of breath. Sometimes hemolytic anemia results from the parasites that attack the red blood cells. Bartonella. Now, anytime I'm looking for Lyme disease, I'm looking for Bartonella. Bartonella is an infection that can cause fevers, headaches, swollen lymph nodes, abdominal pain, fatigue, poor appetite. It's also been associated with brain-based symptoms, including depression, anxiety, panic disorder, and pediatric acute onset neuropsychological syndrome or neuropsychiatric syndrome there. So these are some things that we need to look at. There's another, I'm probably going to mess this up too, Erlichiosis. How do you like that? Erlichiosis symptoms include flu, fatigue, fever, chills, headache, muscle aches, and pains. Mycoplasmas are the smallest bacterial species known, and we test for mycoplasma here. Symptoms include fever, cough, bronchitis, sore throat, headache, and tiredness. Sometimes pneumonia is the result of a mycoplasma infection. Now, if you're paying attention to what's going on in the world, there are a lot of pneumonia cases out there. And so I just wonder, right? I'm wondering if they are, the pneumonia is the cause of the virus, as we're being told, or if possibly it is a mycoplasma-borne illness. So the next illness we want to talk about is rickettsitis. No, I didn't say that right. Rickettsitis. I can't say it. Erlichiosis, I think. Rocky Mountain spotted fever is included in this group of infections, and it can be contracted anywhere in the United States. Common symptoms include fever, body ache, stomach pain, nausea, vomiting, and headache. It causes a red rash on the palms of the hands in 50 to 85% of the people. Now, I don't know if you've read Suzanne Summers' book, Knockout. It's a good book to read. It's all about her journey with, I think it's 13 medical doctors. She was taken to the hospital. They told her she had cancer. They told her she needed to do all these different protocols. She wasn't buying it. She had some extreme thorough testing. And what she had is Rocky Mountain spotted fever. And so that can present these symptoms that look like cancer. So make sure that you get a definitive diagnosis before you start any kind of intensive treatment plan. Also, ticks carry viruses. The Palsy virus, the South Bay virus, the Laurel Lake virus, the Suffolk virus, and various blackleg tick have flaviviruses, right? So you don't want to have any of that. I remember my grandmother used to have phlebitis all the time. She may have been bitten by one of these ticks. I don't know. She didn't live in the Northeast. She lived in the country, and she had this horrible disease. It was chronic. I remember it very, very well. So these are the most common tick-borne illnesses and co-infection associated with Lyme. There are many more. They have overlapping symptoms. And so it is difficult to ascertain what is what. And this is why a lot of holistic practitioners think that Lyme is not necessarily the specific bacteria, although these bacteria are present, but they are more, they're lumping all of the symptoms together, and they're calling it this disease when they're really not doing their due diligence on the testing to really say that this is what it is. Now, we know that our body is a vibrational symphony. We know that when everything is vibrating at the right frequency for that system, our whole body is like a symphony and it is in tune. When you have the presence of tick-borne pathogens, or any pathogens for that matter, it changes the vibrational frequency. When you change the vibrational frequency, your body just doesn't respond the way it is supposed to. You set up biofilms, you have chronic illness, even to get to an autoimmune disease. We don't want that. So we're giving you this information so that you can be armed. You can have this information so when your doctor says you have XYZ, you can look. You can ask for these various tests that we're going to go into a little bit later. And you can make the right determination for your specific body. And I apologize for my throat. I promise you, I am not sick. There are allergies in the air. Excuse me. It is at the end of our time. It is Friday. That means the weekend is here. We're in the holiday season, people. It is December. So I don't know if you're decorating. I don't know if you're shopping. I don't know what you're doing, but we want you to get some self-care in. If you are in the Houston area, just want to remind you that the downtown Humble Christmas Parade is this next Tuesday, December the 7th at 6:30 p.m. Rain or shine. It is the largest small town Christmas parade, I think, in the whole United States. I know in the state of Texas, but I think it's actually, we've got 6,000, 7,000 people that come every year. It's great. We're going to be there. So if you're not doing anything next Tuesday, it's a great thing to bring your children. There's live music. There's Santa. You get to go sit on Santa's lap and do your list and all that kind of stuff. It is a great, great experience. So I just want to throw that out there. If you're in the area, then you want to put that on your calendar because it is not to be missed. I will see you next week. Do self-care. Remember that we love you and we appreciate the time that you've given us today. Go ahead and share the video, comment on the video. We'll comment back. And we know that Facebook shares it, the more comments and shares and likes that we get. So help us get the message out because this is important information. A lot of people don't understand Lyme disease. We're going to continue the discussion next week, and I will talk to you then. Take care. Bye-bye.